I'm Dr. Brett Langston. I'm a prosthodontist, and I'm the owner here at Dental Implant and Aesthetic Specialists, located in Brookhaven, Georgia. And I'm here to help you watch your mouth. Today we're going to be talking about fluoride. For a long time, fluoride has been kind of a staple of pediatric dentistry, which is wonderful. As our teeth grow and they develop, especially in those cumulative years of childhood, when, to be honest, I've got kids, I know they don't do the best job of brushing their teeth. So anything we can do to help protect those teeth until they get better oral hygiene habits is a plus in my book. Fluoride treatment has always been a big part of that pediatric dental visit. They clean the teeth, they get a nice tasty fluoride treatment at the end, 1 to 2 minutes in that tray. A lot of us probably remember those times sitting in the tray with the suction in our mouth, just waiting for the time to pass. My favorite was strawberry, I don't know, mint, chocolate. Now they've got all sorts of flavors. The question I get from parents a lot of time is, why do we stop doing that, or when did that become a thing we don't do on adults anymore? And that's a great question. In fact, in our practice, we're pushing a lot more for the fluoride treatment on adults. As two things have kind of happened. As you get older, you take better care of your teeth, which is awesome. We love that. But also, especially in today's day and age, you stop drinking tap water. You start drinking a lot more bottled water. And bottled water, while it might be purified and reverse osmosis and triple filtered and whatever they do to it, charcoal filtered, a lot of times there's no fluoride in that water. And so people that used to get a lot of fluoride out of their water, tap water, don't get that anymore. And so teeth, we've noticed, with that less fluoride in the water, are starting to become a little bit more susceptible to cavities and breaking down. And so in our practice, we're starting to really implement more of a fluoride treatment when you get a cleaning. That's kind of a staple of our practice now. When you get your teeth cleaned, we obviously do cancer check. We check to make sure there's no broken teeth, make sure there's no broken fillings, make sure your existing crowns and bridges are intact and there's no decay at the edges. With the x-rays, we check and make sure the bone is healthy. We check and make sure any previous root canals you had are intact, there's no infection. We check and make sure that radiographically all the bone around your implants look great. We check for wear and tear on the jaw joints. Basically, we do a full inspection, but we've started doing fluoride treatment. I think it's a wonderful thing for our patients because fluoride allows the tooth to build up a kind of more defensive, protective enamel layer. And in dentistry, anything that we can do to prevent having to do something more invasive is definitely a win, because if you have to go in there with a burr and take away unhealthy tooth structure, all of a sudden the tooth is more susceptible to further breakdown over time, and eventually every filling will grow up to be a bigger filling, and at some point that bigger filling is probably going to grow up to be a crown. And so it's one of those things, if we can prevent the start of that pattern, it's a great thing. One of the other really cool advances in fluoride, there's a material called SDF, which is stannous diamide fluoride. And it was originally made to help kind of combat third world countries' dental decay. So areas where people couldn't get to a dentist and they couldn't get dental care, this material, it's got silver in it. This material, you put it on the tooth, you put it on the decay, and it instantly kills the decay because silver is anti-cariogenic. It kills the bacteria that cause tooth decay. So you put it on the teeth, it'll instantly stop any decay on the spot. Now, it doesn't stop the further development of new decay, and so it's not a one-time application cures all, but in areas where you can't get to dental care and you've got decay and it's encroaching towards the nerve and it's going to potentially cause a problem where that tooth might have to be extracted down the line, you can put SDF on there and kind of pause that decay. So what we're doing is now in areas where if we have a tooth that we don't want to extract, or a tooth that somebody can't afford to do a big dental treatment on, we need to buy some time, SDF does a really good job of kind of pausing that decay. So it's really cool, the technology that's out there. And in that same vein, there's some new materials coming down the market that actually will help the tooth remineralize. So if you've got a pre-cavity, something that's just starting to be a cavity, in the past we would have to probably take a burr, remove that unhealthy tooth structure, and put a tooth color filling in there. Now we've got the capability where we can put this material on there and it forms a matrix, and then your body will actually put minerals in there that help rebuild that outer layer. So it's not like we can rebuild teeth or anything crazy like that, but there are things we can do that if we catch it early, we can prevent having to do more involved treatment. So all that kind of comes back to the importance of a regular hygiene routine, not only your home care, but also coming in and seeing us every at least 6 months, even if you have no cavities, if you've never had a filling in your life. You don't want to be that one person who's like, I don't have to go to the dentist, and all of a sudden you come in and you've got all these little tiny cavities all around that's going to cause you have to go through a lot of fillings and a lot of time and a lot of money invested to fix that, when it could have been prevented had you come in every 6 months just for a regular cleaning and checkup. So while the internet is a great source of information for some things, there seems to be a lot of anti-fluoride material out there. There are even communities now that are trying to prevent the fluoridation of your water. And from a dental perspective, I can tell you the benefits of fluoride way outweigh the negative risks. And to be honest, to have the negative impact that people claim fluoride causes, you would have to go through tons of toothpaste a day, like just eating tubes all day long. And that's just not realistic. And so fluoride does a phenomenal job. I mean, there reaches a point where once you've got enough fluoride in there, you kind of maxed out the amount it can help your teeth. But the value of fluoride versus no fluoride, we see it every day. And any dentist will tell you, you can tell patients that had fluoridated water when they were growing up versus patients that didn't. The ones that didn't have the fluoride, that were raised on well water maybe, or were raised on other kinds of water, the teeth are more prone to decay, they're more prone to breaking down. The quote we always hear is, "I've got soft teeth." And while that might not be accurate, it actually turns out to be pretty true in the sense that they're more susceptible to breakdown and decay. And so fluoride is not a big scam. It's not like I don't get a check every week from the fluoride people for giving fluoride to people and putting it in the water. It has definitely helped us help our patients keep their teeth longer. One thing I tell patients a lot is fluoride in your teeth is kind of like putting rebar in concrete. You don't see it, but if it's there, it helps reinforce and strengthen it. And obviously you don't want a building made out of rebar, but concrete reinforced rebar is infinitely stronger than just regular concrete. And so that's kind of what I tell patients fluoride does. It helps support and make that tooth stronger and more defensive to the wear and tear of the oral cavity. So if you have any questions about fluoride treatments, is fluoride right for me? Can I use fluoride? What are my options? Give us a call. We'll take care of you. I'm Dr. Brett Langston. I'm a prosthodontist. I'm the owner of Dental Implant and Aesthetic Specialists, and I'm here to help you watch your mouth.
Cool.
Awesome.